the Healers Collective Forum. So I'm so pleased that you are taking your time out to have this conversation with us. And our topic for today is around maintaining professional boundaries when working with Muslim clients. And this is a question that is raised by many Muslim mental health professionals who either live or work in the community. And so we're responding to the needs of Muslim mental health professionals who are thinking through topics related to, how we form our professional identity, some of the issues that we face working with Muslim clients, but also how we are able to stay connected and work with each other as a network in order to strengthen the work that we do. So my name is Camila Rashad. I'm the founder of Muslim Wellness Foundation. And the Healers Collective is an online forum for Muslim mental health professionals to connect and discuss pertinent issues impacting our community and profession from a clinical perspective. It offers an opportunity to network with colleagues, share innovative academic research, discuss clinical insights and therapeutic approaches, as well as explore the impact of spirituality and religion, race, gender on professional identity and practice. So we're, inshallah, we're hoping that these conversations are beneficial to us as a profession, but also serves to keep us all well connected, because the work can get somewhat, you can feel alone depending on where you are if there aren't many other Muslim mental health professionals in your area. So this is one way in which we can kind of share ideas and talk about some of the rewards and challenges of the work that we do. So for today, we have a great panel of experts who are going to share their perspectives as well as a case study on maintaining professional boundaries. So our first panelist is Dr. Salman Tour from the Family Center of Knoxville. He is the director of the Family Center. He is also a clinical psychologist practicing, and he'll be able to explain more about his background and what he does. Dr. Sadia Chowdhury, who's also a licensed clinical psychologist practicing in New York City. And last but not least, Sister Farida Salim Boyer. She is the co-founder of the Family Centered Outpatient Therapy Services here in Philadelphia, and she is a marriage and family therapist. So, alhamdulillah, we have a really nice mix of panelists who will be able to share their perspectives. So the way that the Hangout will work, if you see there's a space for you to offer comments. If you have a question for one of the panelists, there will be time towards the end for Q&A. So I'm going to jump right in and get started with Dr. Tour. If you can, explain a little bit about your background and what you do, and begin to answer some of the questions that I know myself and others have kind of wrestled with when it comes to professional boundaries. So what we know is that every major professional organization within the field of either psychology, social work, or counseling really stresses the importance of avoiding as much as possible relationships with clients outside of the therapeutic setting. But what we know from kind of very small Muslim community is that sometimes this is unavoidable. So how do we balance the desire to maintain our professional identity and ethical obligations while working and or living in a relatively small faith community? So that's the question. And so I'm excited for this discussion. And thank you all so very much for taking out your time. I know you're all really busy. So we can get started. Dr. Tour, if you'd like to go first.
Assalamu alaikum, everyone. How are you doing today? So my name is Dr. Salman Tour. I am a clinical psychologist in Knoxville, Tennessee. The name of my practice is the Family Center of Knoxville. And I apologize, but it seems like my presentation is a little bit screwy, so please bear with me. I wanted to just talk about the healthy boundaries kind of subject and whatnot, but before that I wanted to give you a little bit of background about myself. So I'm a licensed clinical psychologist. I completed my PhD in clinical psychology at the University of Tennessee. And prior to that, I did a master's in general experimental psychology. Um, and I did kind of do my bachelor's in psychology as well. But I bring that up because before we get started about the healthy boundaries topic, I just wanted to talk about my training. I took a very diverse approach to training because I felt like if you're going to be a licensed or if you're going to be a psychologist, you should try to get as much training as you can and try to get as many experiences as you can. One, to really make sure that you're doing what you want to do, but then also because from different perspectives, I think it really informs on kind of how you are as a professional. So just a little tip, I think you should get as much training as you can with as many populations. So even if you want to work with kids or adults or whatnot, try to at least do one little rotation with a population that you may not be interested in. So when it comes to a healthy boundary, what is a healthy boundary? You'll find in grad school that professors are really good about defining it concretely, and it feels like, oh, okay, this makes sense. But in reality, what's happening is that I have found personally that it's a little more complicated in the real world. So healthy boundaries might be easy to define in grad school, but in the real world, it seems to be a little bit more complex. But I think there's 4 things that you can kind of try to accomplish when you're talking about healthy boundaries, especially with a patient. Is one, you want to be clear in the boundary, and you want to make sure that it's easily understandable, and that kind of leads to the second approach, to where you want to make sure that you simplify the definition of a healthy boundary with your patient, in the sense that you want to be concrete and you want to make sure you explain it and you talk about it in a way that's not complicated. You're not using a lot of psychological jargon, and you want to make sure that you're meeting the patient at their psychological level. Thirdly, you want to be proactive in forming that healthy boundary. So you don't want to wait until there's some sort of crisis in the therapy room. So maybe as you're proactive in how you're talking about confidentiality, how you're talking about your professionalism, how you're talking about the therapist and the patient's responsibility in therapy, that's a good time to talk about boundaries as well. So especially with the Muslim community, we're kind of a boundaryless community, in the sense that we all feel like, and it's a positive thing, right? There's a sense of family, there's a sense of, a community is behind you, you're not by yourself. But when it comes to therapy, even though people look for help within the community with your sessions or whatnot, it should be kind of proactively talked about, in the sense that, hey, if I see you at Juma, if I see you at this community event, if I see you at this volunteer opportunity, let's handle it this way. What do you think? And then co-create kind of that boundary and say, what do you feel like is an appropriate boundary? And if it feels like it's not appropriate, have that conversation with them, but be proactive about it. And then lastly, in grad school, I think, especially myself, I was psychodynamically trained. A lot of my professors and supervisors would say, you've got to make sure you keep the frame, and you don't, maybe you shake their hands, but you don't tell them personal information. You don't, just try with small talk. You stay very professional, and you do analysis and whatnot. But I've learned that that doesn't really apply in the real world, and especially when you look at the population that you work with. So to continue kind of the talk about healthy boundaries, some examples to think about is, what does a healthy boundary look like in the therapy room? So one of the biggest things is the time of your session, right? So in the Muslim community, everyone's been to a Muslim wedding, right? Like they say, be there at 7, and most people take that at 8 o'clock. But in your practice, especially in private practice, or even if you're at a community agency, right, you have a 50-minute session, or you have a certain allotted time, and if your appointment's at 10 o'clock and they show up at 10:30 because they kind of think it's no big deal, like, that's a great opportunity to, one, explain to them that it's a 50-minute session or a 30-minute session or whatnot. So for today, we're going to go from 10 to 10:50, and I apologize if that catches you off guard, but that's the way that we're going to go from here on out. And if they're offended, right, just simply explain to them kind of how therapy works, and how your time is valuable, but their time is valuable as well. And this is part of them learning and forming healthy relationships within themselves and with other people. So another example is um, social media, right? 10 years ago, this wasn't an issue, but now everyone is on Twitter and Facebook and whatnot. So how do you manage kind of your online presence, especially when you get an invite to become a friend with a community member that maybe you just strictly see in the therapy room. So I personally, I talk to patients about, yes, I'm on Facebook or yes, I'm on Twitter or whatnot, but I try to keep a strict policy of I can't be your Facebook friend, and not because it's something personal, but because I think it's important for you and for me to practice having a healthy boundary, because that's going to be something, excuse me, that's beneficial for the patient and myself in my training and in my professionalism. And then lastly, the most kind of difficult healthy boundary to maintain is in the community, right? If you see a patient and you talk about all these things and you feel like you're confident and you've set a healthy boundary, and then all of a sudden you show up for a volunteer opportunity or a board meeting or something like that, and they're there. So there's no perfect solution, but it might be to where you try to manage it in the moment and then talk about it or process it once you return to a therapy session. So one thing that I think we don't really think about, but we should, is as a psychologist, how do you, or as a therapist or a social worker, but as a professional, how do you manage your own boundaries in your personal life? And I think that's something, people talk about in the terms of transference and counterference, but that's something that you really need to be thoughtful about, in the sense of how do your biases and how do your patterns of behavior in your own life affect your therapy? So do you have any biases when it comes to men or women, or kids versus adults, or people that have specific issues that may be relevant to your life? So maybe you have someone in your family that abused drugs or substances or struggled with depression, and to really be aware of how is that affecting kind of how I perceive therapy, and am I able to separate my personal with my professional? So I think it's very important to really not only be aware of your boundary with your patient, but also be aware of your boundary within yourself, and how your own upbringing, how your own training, how your own experiences affected how you see boundaries. And I think that's where peer support, so a great kind of medium like we have here tonight, and peer consultation can be really, really beneficial. So now I want to talk about a case study, and we'll call this person Mr. A. And just to give you a little bit of background, this person was younger than 18, and I kind of described him as a community family. So basically a family that had been in the community for a while, and people know this family and they're active, and things like that. And what happened was, talking about boundaries, it was a very boundaryless experience. It was a public incident, and when I say that, I mean we were in a setting where there were 20, 30, maybe even 40 other people within the community that that saw what happened. And so basically confidentiality was completely compromised, right? And it wasn't kind of a subtle thing. It was something that became very serious. And outside professionals were needed, whether that was police or mobile crisis or other family members or EMTs or whatnot. So it was very obvious that something was going on. And the boundary part was, as I said, already compromised, but the boundary training really kicked in afterward, right? Because you had all these community members that were privy to what happened. So days and weeks after, I had people coming up to me and saying, how is so-and-so? Is there anything we can do? We heard that this happened or that happened. So there are a lot of rumors flying around, and a lot of gossiping, unfortunately. So instead of addressing it, I met with that young person's family and I said, let's talk about what happened, what you guys are comfortable with, how we're going to present it, and whatnot. And so we came up with a plan, and everyone decided it was best to kind of not address this thing. Someone mentioned maybe we should do kind of a community press conference, but we decided against that. And we had to do a lot of work to keep a very healthy boundary of saying it's a private Family Matter, we know that a lot of people have, insinuations and ideas of what happened, but we're not able to talk about it now. If the family feels uh, the community needs to know or whatnot, they'll address it when it comes time. So even, this situation happened months or years ago, and I'm still approached at times by people to kind of ask what happened. So healthy boundaries, this is, usually when we do a case study, it's something that works out beautifully, and I wanted to put something out there that worked out kind of haphazardly and is still kind of ambiguous to a lot of people. But I think when something doesn't feel clear, always consult with your peers or with a professional certainly, and then also talk to people that you are allowed to talk to, where confidentiality isn't compromised if you have a release of information or if it's the family and whatnot, and make sure that you're all on the same page. And I think that's a very important kind of thing. So I don't want to take up too much time because we have two other great panelists that I think we all want to hear from, but I hope this was helpful. I hope the presentation worked out. I have a feeling it did not, but I've written a little bit on my website about healthy boundaries and whatnot, so if you can't see it, you can go to my website. It's tfcknoxville.com and just search boundaries or Facebook relationships, and I think there's a blog post in there that might be helpful. So Jazakallah khair, and I hope this was helpful, and I look forward to hearing the other panelists. Thank you.
Okay, thank you so much, Dr. Tour, for offering those explanations. And I think, as you said, I can't emphasize enough how important it is to get that peer consultation, because often, unlike other professions, we don't do the kind of work where we can go home and say, oh, this is the kind of day I had, at the office. So being able to discuss these topics with other professionals really is essential to being able to process what's going on and to kind of get suggestions or feedback for, sometimes, like you said, we think we handle something really wonderfully in the session, and then there are other times when we don't handle it so well. So being able to get that that feedback is really essential. I want to go to our next panelist, Dr. Sadia Chowdhury. She's also a licensed clinical psychologist and is going to offer her explanation as to her background, but also her perspective on the development of boundaries and maintenance of boundaries, but also kind of a case study and how this is not as simple as perhaps we learn in school, but that in the real world things get a little more complicated. So Dr. Chowdhury?
Thank you, Camila. Assalamu alaikum, everyone. So thank you also, Salman, for an excellent explanation about healthy boundaries. I wanted to begin by speaking about my background as well. And just very briefly, I got my bachelor's degree in South Asian Regional Studies and then went on to do both my master's and PhD at Columbia in clinical psychology. And my dissertation there was on attitudes towards the diagnosis and treatment of depression among South Asian Muslim Americans, and really looking at the stigma and the barriers to treatment that emerge. After finishing my PhD, I went on to do a postdoctoral fellowship in child and adolescent psychology at New York Presbyterian. And like Salman, I strongly encourage, when you're in clinical training, please go out and seek out as many different varied experiences as you can. Do the rotations that intimidate you, do the things that you find the most challenging, because training is really the time to really push your boundaries and see and challenge yourself, and really find out what it is that you enjoy doing. So what am I doing today? Currently, I'm a research scientist at Columbia University, and my research there focuses on predictors of suicidal behavior, and also developing evidence-based interventions for suicide. And alongside that, I'm a licensed clinical psychologist in private practice. My specialty areas are in mood and anxiety disorders, and I have a specific interest in working with individuals who self-harm or engage in non-suicidal self-injury. I have intensive training in both cognitive behavior therapy and dialectical behavior therapy, and those are the two primary modalities I use in my private practice. However, I do see a wide range of patients, children, adolescents, adults, couples, and families. So along with that, I do also incorporate some psychodynamic work as appropriate, some relational work as appropriate. And my practice is really fairly diverse, both in terms of age and also racial and ethnic background. I would say right now about approximately half of the patients I see in private practice are Muslim, and the other half are not. So healthy boundaries, I think this is something that we learn about a lot in grad school. It's something that I know we started discussing on day one, and it was always a big thing in terms of how do you maintain healthy boundaries? What is a proper boundary for you, and how do you set those limits? And the things that I remember from grad school most clearly were, focusing on maintaining clear and consistent boundaries. So kind of setting up rules that you establish, that you maintain with all of your patients, always trying to avoid dual relationships, and limiting self-disclosure. So really avoiding speaking about yourself or discussing anything pertaining to yourself within the context of the therapeutic relationship. But what happens is, or at least what my experience was, that when you are in the real world, it's not as easy as what we're taught in school or what the textbooks say. I think, in the room, one of the first things that come to mind is, what do they see when they first see you? As much as, you want to avoid self-disclosure, patients will develop a first impression when they see you, and vice versa. And it's not a blank slate. So it's important to think about these things within the context of boundaries. I also think it's really important to explain confidentiality and the boundaries of the therapeutic relationship very early on in your work with someone. And this is, I think, especially true with Muslim patients who have not been in therapy before, because it is a very different kind of relationship, and it can be confusing. And you have to remember that they sought, oftentimes they sought you out because they're looking for someone like themselves. And to allow for that relationship while also maintaining a boundary requires quite a bit of balance. Outside of the room, you also want to think, as Salman had mentioned, social media, Facebook, Twitter, all these things. Most of us have an online presence, and as much as we try to keep ourselves private, things can be found. There's always the problem of mutual friends, so you may not think you know someone, but they may know someone that you know, and vice versa. And also boundaries within the context of the community. What happens when you run into someone in the mosque or a social gathering, or you're out at a restaurant with your family and all of a sudden you run into a patient? How do you deal with that? I think it's really important to talk about these things very candidly, not only at the start of therapy, but throughout the context of your relationship. As your therapeutic relationship develops, to also continue to talk about the context of these boundaries. What do you do when you see someone in a mosque? Do you acknowledge them? Do you not? I tend to leave it up to the patient. I say that I won't, even if you tell me it's okay for me to approach you, I will not, unless you approach me first and you take the lead, because people make assumptions, and you may think that you feel comfortable with allowing people to know that we know each other, but then in reality it may not be the case. So really talking those things out, I think, is really critical. Other things to think about are cultural considerations. Gifts, which, again, in grad school, we were always taught, you never, ever, ever accept a gift from a patient. But what do you do when Eid comes around and your patient, gets you a small token? Do you say no? Do you say yes? I think, these decisions are personal, and I would encourage all of you to think about what is appropriate for you. And I think no matter what the decision is, when it comes to gifts, I think it's important to discuss the reason for why the patient is giving you the gift, and to make sure that that's something that's addressed whether or not you decide to accept it. There's also the matter of self-disclosure. Like I said, just from, nobody is a blank slate. Your name tells you something about, tells the patient something about you, your hair color, your features, all these things tell, already start the process of self-disclosure. So you really want to think about how comfortable you are talking about these things. I myself am Bangladeshi by origin, and one of the most common questions that come up when Bengalis meet each other is, oh, what town is your family from? And to not answer that is considered to be very rude. So what do you do in a situation like this when your patient knows that you're Bengali? Do you answer? Do you not answer? Again, I think these things are personal, but worth thinking about what feels appropriate for you. Another thing that has come up a lot for me are waiting room interactions. So I see some patients with whom I do therapy in Bengali, and others, most of my patients, I speak to them in English, obviously. But what happens when you greet one patient in the waiting room in Bengali, and the other person there notices, hey, she's speaking another language? It brings up discussions, and it brings up questions, and in my experience, it's always better to open up the conversation before things build up, because again, nothing happens in a vacuum. So I also wanted to talk about a case study. I'm going to talk about Mr. N, who was a patient who came to me. He was of Bangladeshi origin and wanted someone who was Bangladeshi Muslim to work with. He was a young adult, and whenever our community in New York, it's large but not that large. So whenever I start therapy, I always, try to make sure, like, okay, is there any overlap? Does anything need to be addressed? And at first, it didn't seem like it was that much of an issue, or that we had any mutual friends or any community overlap. So we began therapy, and then a few weeks in, he came in and said, oh, Dr. Chaudhry, I saw that you went to so-and-so over the weekend. And I'm like, how? Like, how did that happen? And it turned out, bizarrely, that he was Facebook friends with my husband, which was something that I never realized. So that was something that needed to be addressed both in the room with the patient in terms of what that meant, but also it led to a discussion at home in terms of, I'm very strict with my boundaries, but also explaining to family members why it's important for them to also put up limits, because once they tag or do whatever it is, things can show up and it can be problematic. So it led to a lot of discussions, and we did get through it, which was nice, but always be aware that no relationship is as private as you may think it is. And I want to make sure that we have time for Frida to speak as well. Thank you very much, and I've attached my email addresses if you have any further questions after this hangout. I'd be happy to address.
Okay. Thank you so much. I mean, I think one of the important points that you raised is how very slight things that we may not actually think too much about, like language, like how do you greet someone? Are you greeting them in Bengali? Are you greeting them in English? And how other clients or patients may interpret that interaction. So I agree. So much of it is about communication, and that we can really use those as opportunities to model how essential it is to be clear, and to constantly revisit those boundaries if we feel like there's been some slight violation. So someone asking you about your weekend because they see a picture or something on Facebook, I mean, that's an opportunity to talk about how they even think about boundaries within their own kind of personal space. So, thank you so much. And I'm really hoping that we'll be able to, inshallah, compile the slides. So if those who are watching and they didn't get everything down or have questions, feel free to submit your questions. But inshallah, we'll also send out those PowerPoints so that people can, be able to reference them later. So our next panelist is Farida Salim Boyer, and she's a marriage and family therapist here in Philadelphia. And she is going to talk a little bit about her experiences and also provide a case example to kind of contextualize all of the different topics that we're talking about. So Farida, you're up.
Assalamu alaikum. Can you hear me? No? Okay. My name is Farida Salim Boyer. I am a marriage and family therapist. I currently have my own private practice at the Family Center Outpatient Therapeutic Services. I've received my Bachelor's of Science from Temple University in 1999, and I worked in the Islamic community as a teacher at a private Muslim school for several years before eventually getting my master's degree from Chestnut Hill College in 2012 as a marriage and family therapist. I have a lot of experience with the Islamic population because as I said, I had the opportunity to work as a teacher. Also, I provided services around the city of Philadelphia at the Resources for Human Development. I was a lead home visitor at Children's Hospital, where I provided home visits within the city of Philadelphia. That provided me the opportunity to go into Muslim families' homes and work with the children and their parents. After receiving my working at the Center for Families and Relationships as an intern, I became a therapist, where I currently work there part-time as well too. As I said, I'm the part owner of the Family Center Outpatient Therapeutic Services, where we provide services to children, adults, individuals, couples, and families in groups. Our mission is to assist individuals, couples, families, and groups to reach a place of wholesomeness as they develop action steps to achieve treatment goals. We're located right outside of Philadelphia off of City Avenue, and our information is posted as well. Marriage and family therapists, they believe that we work from a systems perspective, meaning a lot of people, when they come to therapy, they don't understand the difference between a marriage and family therapist and other therapists, where we kind of work as a whole with the family. So there will be times where I may suggest that a mother bring in her children, or bring in her husband, or bring in any family member who can better assist her with telling her story to obtain the assistance that she needs. And so what is a marriage and family therapy? Marriage and family therapists believe the most powerful forces in our lives are located externally within the family. As I said, we use a systems perspective, and we're family focused. Ethical boundaries. What we need to understand is, or clients need to understand, that therapy is for the benefit of the client. It's not to get to know who your therapist is, what your therapist is doing on the weekend. It's solely to better the client. So as a therapist, we must acknowledge the fact that clients are entitled to confidentiality. So when treating clients, that's the first thing that we go over, the HIPAA laws, and helping them to understand that whatever happens in therapy stays in therapy. And I'm also cognizant of the fact that explaining to them that if there's a concern with their children, that is my responsibility as a mandated reporter to report those things. So that's basically the only thing that I don't have to let them know that I'll be discussing with somebody, is letting them know if I feel like there's a child in harm. Dual relationships. This is clear and concise. In the beginning of treatment, I try to go over with the client. Everything is about joining with the client, obtaining a therapeutic relationship. Our therapeutic relationship is built on trust and honesty. So I understand when clients first come, they're not as open as they normally would be. So after several sessions, they feel more comfortable, and it's up to the therapist to help them feel comfortable and explain to them that whatever they're going to say in the session is going to stay in the session. Some examples of dual relationships. So the therapist is not able to go into the client's home for any type of functions. Therapists should not do business with clients of any sort. And serving on committees together is another dual relationship. Or if after a while you decide that you have an interest in a certain client, it's not appropriate to have a relationship with any of your clients outside of the therapeutic relationship. There are over 75,000 Muslims that live in Philadelphia. It's hard to not know some of your clients, because a lot of Muslims came through Sister Clara Muhammad School, where there were thousands of students taught and grew up to be Muslim. So you have those relationships, or you'll see those clients at Eid or at the masjid, and some of them may want you to service their child. So you may not have a friendship with that person, but it's hard to get around not knowing some of the Muslims in the community and providing them with services. And what I've noticed that a lot of Muslims, they feel comfortable with doing business with other Muslims and having them as their therapists because they share some of the same values. One thing that I want to point out is, because I've had several Muslim clients that initially I visit several different masjids, so I explain to them, if they mention a masjid that I frequent, I may say to them, I frequent that masjid. If I see you at the masjid, how do you want me to address you? Do you want me to give you the salams, ignore the fact that you're there, or how do we decide to acknowledge one another? So I let the client decide on if they want to speak. There are some clients who I've had that acknowledge me as their therapist, and other their people that were with them may have asked for a card or something of the sort. So my case example is, it was recommended by a special victim unit that a mother bring her 8-year-old daughter for outpatient treatment after being fondled by her older cousin. What happened was, after a few sessions, I realized that I knew the father of the accuser. So what I did was initially I removed the daughter from the office space, and I had a conversation with the mother, explaining to her that I knew this young man's father, and it wouldn't be appropriate for me to continuously serving the clients because of the relationship that I had with the father. We weren't friends, but I knew him very well. So I referred the clients to another therapist. In addition, I asked the mother, because they were Muslim, how do you want, if you see me in the community, how do you want your daughter to address me, and how should I address her as well? Because there are times we're at Eids and other Islamic functions, and we see each other often. It could be daily, on Fridays at Juma, other functions. Muslims in Philadelphia, especially women, gather often. So there's things that they may be at that I'm at, and I just want to know what's appropriate, how to make them feel comfortable. So pros and cons when working with Muslims. And after I did the list, I looked at some of the hindrances, and I'm thinking, well, that could be a pro as well. So some of the things I said is the pros is the overall belief system. Working with clients that share the same values as you do. The most important thing is, and my goal as a therapist, is to help keep the family intact. So knowing that I'm preserving Muslim families is a great asset for me. Some of the difficulties of dealing with Muslim clients is wanting for your brother or sister what you want for yourself, meaning that you may want the best for them, but you have to keep a therapeutic relationship when you're dealing with any client, so you can't step over those lines. Another hindrance I said was ease and Islamic functions. I don't want to keep my family away from attending these functions because I may have a client that is at the Eid and trying to preserve our family. It's just sometimes difficult with being in such a small community and providing a type of service that you have to have confidentiality with your clients. And now the tips for a new therapist, I would say you should always set clear boundaries with your clients. Document everything, because if it's not right and it didn't happen, supervision is essential for an effective therapist. It's important for you to get some outside resources as a therapist. Take time for yourself. This is hard work that we do. You're dealing with somebody's issues every day, sometimes majority of the day, and you need to take time for yourself. Meet with your own therapist would be beneficial because you have an outlet to discuss what's going on in your own life and someone just to listen to all of the things that you're going through. And establish a trust and relationship with your peers, because sometimes it's just helpful when you're leaving a session and you may be feeling overwhelmed, just to have somebody to talk to that you can confide in. And that is it for me.
Okay, thank you, Farida. I'm really excited because you all both brought up some really important points, about dealing with Muslim clients in the community, but also I think one of the last things that you mentioned about documentation kind of leads me to this question, and I want to open it up for the three of you to discuss this, but also to think through how do you approach, even as a mandated reporter, right? If something comes in the therapy session and you're dealing with perhaps allegations of abuse of a child or an elderly member of the family, when you're working in the Muslim community, how difficult is it to then actually have to pursue and disclose to them that given what has been reported in the session, that you will have to notify the authorities, or perhaps if someone is expressing suicidal ideation and your recommendation is hospitalization, how do you talk about that when they may say, well, I trusted you, you're a member of the community, and now you're going to bring in these other outside agencies into my family or into my home. One, have either of you dealt with something like that, or what would your recommendations be? So you guys can unmute your mics if you want to kind of take a stab at that. If you're a mandated reporter and something comes out in a therapy session, how do you deal with that and kind of explain it to your Muslim client?
I think the most important thing is just to have that therapeutic relationship with them and help the client understand that you want the best for them, and helping them to obtain the resources to get them that help means that sometimes you may have to do things that's difficult for the client. And if you have that relationship with them, I think eventually it may be a hardship on them, but they will eventually get the help they need and understand what has happened, and it's for the benefit of the client.
Yeah, to kind of piggyback on what Frida said, I think it really does come down to, the duty to warn stuff that you talk to them about in that first session. And I know for me, especially with teenagers, but even with families, when something like this comes up, that is going to, without a doubt, cause some sort of friction or negative feedback towards the therapist, is to say, I'm doing this not to make your life difficult. I'm doing this because I care about you, and I have to make sure that everyone I come in contact with is safe. And if I feel as a professional that someone's in a dangerous situation, like, it's my job as a professional. But I think we all got into this field, we're interested in it because at a human level, we want to help people. And so I talk to people about, even as a Muslim, as a human being, like, I think it's my duty to make sure everyone's safe and to do what I can to help others. And sometimes you may not understand it, like Frida said initially, but usually, especially if they stick with you in therapy, you can say to them, like, that was very difficult, but this was me showing you what's healthy and what it's like for someone to care about you. And I think that's a really important part of the therapeutic alliance, or, rapport. So.
I agree. Fostering that therapeutic alliance is so critical. And I think it's really, really important to talk about these things, not just at the first session, but throughout, in terms of mandated reporting and, what happens if you become acutely suicidal? How do I make sure that you're safe? And make sure that it doesn't feel like you're abandoning them, because I think that's the first reaction, is that, oh, I came to you because you understand me, and look, you're throwing me right back out to the wolves, and making it very clear that that's not what you're doing, and that you will be there to help them through this process, whatever it may be. I think as a clinician, you should anticipate the anger and accept it and help them work through it, and hopefully see them through to the other end.
So here's another question I have. What do you find to be the most challenging or difficult aspect of working with Muslim clients? Just in your experience, what have been some of those things that maybe perhaps in your graduate training you didn't anticipate, or you have a really strong desire to be a helper in your community, but it's not always easy. So what would you say is the most challenging or difficult aspect?
I think for me, two things come up. I think one is, and kind of jokingly, but the auntie and uncle effect, like the idea that they know what's right, and their personality has been hardened for 30 or 40 years, and that's actually true for anyone, and it's really difficult for them to understand something in a different way. And I think the other thing, now on a more serious note, is the lack of education that's out there about mental health. Like the idea that if your child is not doing well in school, it doesn't mean that they're lazy, it doesn't mean that they're stupid. Sometimes it could just mean that they're unhappy and that they're depressed. And even when, in the few talks that I've given in the community, when I reflect back on what I talk about, and I really hope this doesn't come off as pretentious, is I realize that you really have to kind of simplify it and literally dumb it down to where when you talk about depression, anxiety, communication, relationships, parenting, all these kind of things, you have to think about it at a very introductory level. And I think when you get into, college and grad school even, you start to think about things in a more complex way. And if you start talking to them about attachment theory or early life experiences and how the childhood might be related to, how they function later in life, you can kind of see their eyes, you can kind of see them glaze over sometimes, and they don't recognize, like, what are you saying? Like, why are you talking about, my kid is 20, they're not 10, why are you talking about that? And I have to catch myself and just to slow down and say, well, let me help you understand, like, and I try to relate it to something in their life, to where if I'm just talking hypothetically, they might get it. But if I say, you know, your child wasn't very religious, or maybe you weren't a very religious home, and then when your kid became 16 or 17, you tried to start saying you have to pray 5 times a day and, you know, fast and whatnot, but you have to recognize that, like, people aren't light switches, they just don't turn it on. So I think one of the biggest things for me is really being aware of that the Muslim community is just now learning about mental health and how it's related to everyday life, and your mental health is not your spiritual life. Like, those are two different things. And to really help them understand that, like, yes, sometimes I know you watch commercials and you think depression is someone sitting in the corner and it's raining outside and they're looking out the window, but sometimes depression can be anger, and sometimes it can be you know, out of control behavior and things like that. So those are two things that kind of came to mind for me.
I think you raise a really important point, because I think, and you know, typical of many professions, you know, you talk about it and think about it all day, but when you have to think about explaining it in the most simplest terms, and particularly in a community where there's going to be some association with spirituality and religion. So how does this relate to whether or not you believe this is because I've sinned in some way and that I'm being punished, or that, you know, I just need to be a better Muslim. So why are you giving me all of these other recommendations when, you know, it's perhaps the reason why I'm experiencing all of these things is because, you know, maybe I'm not praying 5 times a day and I'm struggling, you know, in the morning and things like that. So knowing, you know, kind of where the level of literacy, I would say, in the community, and starting from there. So Farida or Sadia, what has been the most difficult or challenging aspect for either of you?
So in terms of the most I mean, I don't think it was the most difficult, but I think something that really caught me off guard once I started practicing privately and seeing a lot of Muslim clients was the intense curiosity about my personal life. Throughout clinical training, I mean, I saw a lot of patients, and you know, we would always talk about the dynamic in the room, but I feel like it's different when it's a Muslim coming to see another Muslim. They come in with certain expectations, and maybe you meet them, maybe you don't, or whatever it is, but there's always a discussion around that. You know, what did you do over the weekend? Where are you going? What are you doing for Eid? Why don't you wear hijab? Or, you know, like all those kinds of things, they come up. And, you know, refocusing the therapy on the patient as opposed to their curiosity about, you know, the therapist was certainly something that I found very challenging in the beginning. And I think anyone who, you know, any Muslim mental health professional who's going to be working with other Muslims, I think it's important to keep that in mind. But I think honestly the most challenging is what Salman was talking about. It's the stigma. It's the you know, not, you know, starting to understand what mental illness is, but not fully grasping the gravity of situations. I think, you know, once a family comes into the room, they realize that there's a problem, but sometimes, you know, addressing that fear and addressing all the things that come with it and all the cultural and spiritual ramifications of acknowledging, you know, whatever the problem may be is very difficult. And it takes a lot of time to peel away all the layers, not just within the patient, but usually, you know, you end up working with several members of the family, whether it is a child or an adult. I found that, you know, bringing the family in is often helpful. But just that part of it has been the most difficult, really meeting them where they are and educating in a way that is palatable for them.
I just want to add that sometimes what has been difficult for me is I see a number of couples. So when I'm dealing with Muslim couples, it's sometimes difficult to help the couple understand when I use a genogram. So if I see a pattern of divorces on a genogram, trying to help the clients understand this appears to be a problem if you have several divorces in a marriage, and some of the clients don't get that. So that has been one of the problems that I have come up with, that I sought out supervision for, because just trying to help clients understand like patterns of behavior, and sometimes just looking within to get what you need and not just doing things because you want to do them. So it's just trying to help them to understand a balance, and understand from a clinical perspective what the patterns of behaviors are looking like.
And when you all are trying to explain some of those patterns or kind of ways of relating or communicating, how do you deal with, and this is kind of related to, the therapeutic alliance, but when they may challenge you on, say, a recommendation or kind of an interpretation that you're giving of the behavior, and they challenge you on it because they feel like, well, I need more of like an Islamic explanation, or I need kind of a more spiritual interpretation of this because what you're telling me sounds too academic, or it sounds too secular. I wonder if any of you have kind of encountered that and how you deal with it, because it relates to, again, this is a professional boundary. So, the same way someone would go to a surgeon kind of seeking recommendations about something that's really important regarding their physical health, I feel like some of the pushback is often related to this not perhaps being integrated into their Islamic understanding.
Yeah, I think that's definitely a battle, and especially, my practice, I probably see 2/3 kids and adolescents, and the 1/3 with or couples and individuals and whatnot. And one of the biggest things, right, is certainly if a youth is struggling, then it's okay. Can you talk to my child about going to more halakas at the masjid on Friday evenings, and attending the youth programs and praying 5 times a day and whatnot, and right, and all, spiritually, religiously, all those things would be great, but I think it depends on the context, certainly, but sometimes I say, like, I agree. Like, I think if they had, if Islam played a more prominent role in their kid's life, they'd probably be better off in some ways. But when I say to a family, hold off on the forcing the 5 prayers a day thing, because that's not going to fix this. And haven't you been trying that for a few years now? Or let's talk about, what are you guys doing right now that's effective or that's working? And then if you're doing something that's working, we will build on that. And more often than not, right, they come to you when they're desperate. And that's another thing in our community. They don't come when the house is starting to smoke. They come when the house is burned down and it's smoldering. So, and I try to do it in a humble way, and I don't do it to kind of throw it in their face, but I say, listen, you obviously care about your kids, you care about your family, you care about yourself, but you've come here because you've sought out my expertise. And I'm very clear, yes, I'm Muslim, but my training is, secular, or I don't have Islamic training. And luckily in Knoxville, we have, a resident scholar. We have quite a few people that are, knowledgeable in relationships from an Islamic perspective. So I'll say to them, feel free to talk to them, and I'll consult with them. I'll kind of say, like, this is what I'm saying. They may come to you and ask about this, but I talk to them about, like, okay, that the Islamic thing is important, but I can help you or your family or yourself with the depression or the anxiety, and a lot of times they're interrelated. So I think a lot of times there's certainly pushback, and I'll kind of say, well, let's see if we can find a compromise, or you tell me what's worked, or I'll say, I've worked with a lot of kids or a lot of teenagers, and it's my experience that if you go down that path and you hammer them over the head with the Quran, like, it's just going to push them farther away, and you need to. And then we talk about identity and independence and things like that, especially when you have a cultural thing where maybe someone's coming from Egypt or Pakistan or North Africa or when, and they're scared that their kid is becoming westernized or whatnot, you have to help educate them with that as well. And that idea that just because they wear jeans or they listen to, you know, rap or rock or whatever, that doesn't mean that you've lost your child or your family or yourself even. So it's definitely a battle, but and I think it's something you just learn over time. But I think that gets back to the boundary, even your boundary as a professional, that like you're not a sheikh, you're not you know, a religious scholar, you're an expert when it comes to mental health and psychology. So that's another part of the education.
Salman, that's such a good point, because I think it's really important to remind them that, you know, even though we are Muslim and even though we may be familiar with Islamic rules and traditions, we are not, that's not our area of expertise, or at least for me, it's not. For me, it's psychology, and to really stress that there is a clear difference between the two, that there may be some overlap that we can address, but there are differences that need to be addressed. You know, as you were talking, it reminded me of something that comes up a lot with the patients that I work with. You know, oftentimes I encourage the use of meditation and mindfulness, and I get a lot of pushback on that, oftentimes from parents, Muslim parents, saying like, no, what is this? This is like Buddhist stuff. You know, don't teach my kids this. This isn't right. They should be praying. They shouldn't be meditating. And then, you know, it opens up a discussion like, okay, so, you know, let's talk about that. Like, what is important about prayer? You know, like, what is it that it does for you, aside from the fact that we are told we have to do it? Why is it important? And how does it make you feel? How does it spiritually connect you? How does it ground you? And, you know, if that works for you, what are ways that we can find for your child to get that too? And introducing mindfulness in that way, in terms that they understand, can help. So it's, again, meeting where they're at and helping them understand some of these psychological principles.
And just to piggyback off what both of the other therapists have discussed, I try to keep it clinical when I'm in the session. I explain to the client that, as you said, I'm not an Islamic scholar, but I am knowledgeable from a clinical aspect, and that is the focus that that we're trying to improve upon in the therapeutic session. So I try to keep it clinical for the most part to assist with the clients. But it is a struggle, because you as an individual share the same beliefs as the client, so you're trying to assist them in making a better life for themselves, and sometimes it's like, but I'm not focusing on the Islam part of it, which makes it sometimes difficult as a therapist.
So my next question is related. So we know what the challenges are. So I want to ask you to kind of think about the rewards, but also the things that you do. You know, what's rewarding about working with Muslim clients, but the things that you do to help maintain those boundaries, like some self-care strategies or things kind of go to for you, because I can imagine, you know, there's a level of objectivity that we cannot claim. You know, this is a community that we are part of, that, you know, if your clients are asking you about if you're going to eat, if you go to, you know, this mosque or that, so there's, you know, when we talk about those 6 degrees of separation, you know, it's very difficult. So I'm curious to find out, you know, what do you find rewarding, but then how do you practice, or what kind of strategies you use for self-care, so that you can deal with those challenges, and, you know, maintain some level of, you know, I would say normalcy in your own life, because you may, you know, people know what you do in the community, so they may come to you just anywhere and start to talk about their problems, or ask you for advice. And so, you know, so on the one hand, you may appreciate the fact that the at least is coming to someone to talk about those really difficult things. But on the other hand, you know, maybe at a function or kind of out at the supermarket, and you're like, okay, how do I manage this, you know, with, you know, the pros and the cons? How do I manage that?
And I think self-care is important, and as I wrote in my PowerPoint, one of the things that I have my own therapist, which I seek often, more often if I'm experiencing some of my own difficulties. I also have supervision. I work with two different supervisors that I receive a lot of support from. In addition, I have peers. Some are therapists, some are social workers who I talk to regularly because some of them are friends. So I get support from all of those people. I also think that there's a time and a place for everything. And if you see me out with my family, then it's not appropriate for me to engage in a conversation about therapy. One, it doesn't benefit you because then my family knows who you are, which I don't think is important and it's not helpful at all.
I agree. Self-care is so important and I think critical to avoid patient burnout. Um, you know, I came into this field because I wanted to help Muslims in the community, and it's such a rewarding experience, but it, you know, it can also be, I think, very emotionally taxing. I think oftentimes the patients that I think about when I'm at home are the ones that are closest to home. And to have, it's so critical to have, you know, support, to have peers or supervisors that you can talk to about these cases. And, you know, they don't necessarily have to be Muslim, because I think a lot of the things that we're talking about here in terms of boundaries and, you know, how much you disclose, it's true, you know, for all therapists, you know, with their patients. You know, there are certain issues that are unique to Muslims, but overall, the issues that we're talking about are universal for all mental health professionals. So I think others can relate, and it's important to seek out that support and, you know, make sure that you're not feeling like you're alone in this. And also making sure that you know, give yourself timeouts, that when you're home or, you know, on the weekends when you're not practicing, to really enjoy the time that you have when you're with your family, and to kind of leave, you know, your practice where it is and your home where it is, I think is critical. So finding that balance and finding, you know, what works for you in terms of a work-life balance is really, really important in order to maintain a proper level of self-care.
Yeah, and I think just to piggyback, even you know, Farida during her presentation talked about a genealogy, and sometimes I tell patients, and you know, I try not to do it in kind of a morbid way, is that when they feel like, oh, you know, I'm 50 or I'm 60, and how much of my life do I have left, or you know, I feel like I've been screwed up by what happened to me as a kid, and now I have kids. Sometimes I say to them like, okay, your grandparents, your parents, you've had problems with you know, relationships or divorce or substance abuse or whatnot. But think of your future. What if you could be like a good parent, you know, to your child, to where they won't, to where they see a good model of behavior that's healthy and whatnot. So I think the reward sometimes, you know, it's interesting, right? Because in the Quran it talks about like you may not be rewarded in this life, but maybe the next. And it's kind of this play off of that, where it's like, okay, I'm not saying your life is over, but it may stay difficult, but you, based on your decision and your personal growth and understanding yourself at a psychological level, you may completely change the direction of your genealogy tree. Like you may completely change the direction of how your kids are going to be and how they're able to their strengths, and, their self-esteem and things like that. And I was kind of nervous to say that to the first person because I was hoping they would be like, well, that's kind of hopeless. My life's over, and I should just. But a lot of people so far, alhamdulillah, have kind of like taken to that, and it's kind of you know that idea of a legacy. I think you know when Erickson talks about like identity and things like that, and then of course you know Farida certainly talked about it quite a bit, so I won't say too much about it. But self-care is very important, right? I personally believe, and I know there's an exception to every rule, but I've yet to see someone come into my office that says, I eat right, I exercise regularly, and I sleep 7 to 8 hours a day, and I'm still depressed, right? So for me, I try to exercise regularly. I don't eat right, but I try to, and I try to get, alhamdulillah, I'm a good sleeper. So I think like I try to do those things, and then just do the activities that you enjoy, like whether it's sports or art or going for walks or spending time with your kids or friends. Find that balance, right? And part of that healthy boundary is I'm going to stop seeing patients at 5 o'clock or 6 or 7 or 8. And if you say I'm going to stop seeing them at 6, when that person calls and says they're in an emergency and they have to see somebody, that's your test. That's your choice to be able to say like, I'm sorry, I wish I could see you at 6, but maybe we can find something else. Or, and if it's a Muslim, there's an extra dynamic there. But if it's a non-Muslim, right, and they're comfortable with whomever, then you have your referral list and you say, I like this person, and this person. I think they do great work. But I think that's part of, even your healthy boundary. If you're going to exercise, don't exercise for 4 hours, right? Be aware and reflect on what's a healthy amount for you. So I think it is finding that balance, peer support. I used to work in the Washington, D.C. area. I still talk to some of my colleagues up there about cases and just about life and just using those kind of support systems. And I certainly agree with Rita, having your own therapist or just someone on call, kind of like a PRN, to where you can say, I've got this, really complex situation. It's stressing me out. I'm having dreams about it. I need to get it off of my chest. So when can I set up an appointment?
So here's probably the last question I have for you guys. What would you say to your young, inexperienced therapist self? Knowing all that you know now, all of the many different experiences and clients that you've had, what would be the one piece of advice you would want your younger self to know about what it means to be a Muslim mental health professional? I know that's a pretty loaded question, so I'm going to give you guys a second to think about it. You're like, I could say so many things.
One thing that I'm gonna say is that peer support, like, is just great. Knowing that you have that you can share, you can get support from other people is just, I think, rewarding, because just going into this, it's like you don't really know what it's like to be a therapist until you become a therapist. It's a lot of responsibility, a lot more than I thought I was gonna get myself into. So I would just tell my younger self is that continue to encourage my younger self to do the best that I can be as a therapist, and just seek out support, like to whomever. Alhamdulillah, you're in a community, you're one of my supports. So if just to have somebody that that you can confide in, and you're not going to be alone, because especially Muslims, like, it's alhamdulillah that you even created the Muslim Wellness Foundation, because there wasn't a lot of information for, like you said, it's fairly new. Mental health is fairly new in the Islamic community, and a lot of people still don't take to it. So it's kind of just having that support that I think makes it a lot easier, and knowing that you have support, knowing that you can do it and be the best therapist that you can be.
So I'm going to kind of cheat because I felt like I had really great supervisors at the University of Tennessee. So come apply, you'll get some really great supervision. But I remember one thing that one of my supervisors said to me, and he was, I don't know, maybe 60, and he'd been practicing for 30 years, and he was watching one of my tapes, and he was reflecting on how he had a similar experience, and he said, Salman, the beautiful thing about our profession is that it's okay to make mistakes, as long as you see it as not as a failure, but a moment of opportunity to improve yourself. And he also said that, like, we're in a field to where we're growing every single year, and it's not a field to where it's robotic and it's predictive and you know what you're going to get. So, and that really sat with me and really comforted me as a young professional, as a graduate student, the idea that, like, take a deep breath. You're going to make mistakes, or you're always going to be learning, because the human condition, human psychology is so complex. I've been licensed for 5 years, like many of us been working in the field unlicensed as a student or whatnot for 5 to 10 years, and I've never seen the same case of depression, right? I've never seen the same story. Every single person I've ever met has a unique story, and people say, don't you get tired of hearing this? Don't you get depressed? And it's like, no, I see it as like a blessing, as an honor that like these people come in and share something that they don't share with anyone else, even their spouses or their parents or their best friends or whatnot. And I always tell myself that like it may feel stressful, but it's still an honor to be working in this field. And these people, right? You're a story listener. These people come in and tell their stories, and sometimes you're kind of like, we're out of time, but keep going. And sometimes it's kind of like, ooh, that's really heavy. Let's do a little bit at a time and process and reflect. So I think if to my younger self, I would say what my supervisor said, in that idea of, being a therapist is a process. You never get to a place to where you're the perfect therapist. And I take that as comfort. I don't take that as anxiety provoking. So that's what I would say.
That's such a great point, Salman. I think if I were to look back and speak to my younger self, the words of encouragement I would give is just stick with it. When I first started telling people, I really I'm interested in mental health. I want to work with Muslims. The reaction was always like, you're crazy, because Muslims don't talk about these things, and no one will ever come see you. So you're going into this field, and no, it's just not worth it. And I'm glad I didn't listen to them, because just, in a few short years to think, having, first feeling like, okay, well, I'm the only Muslim doing this that I know of, to alhamdulillah now being part of this wonderful community. I mean, it's amazing how much we've grown in just a few short years, and to think of, inshallah, what is yet to come. It's such an exciting prospect. So, sticking with it, learning, as Salman was saying, it's such a, we are all works in progress. As therapists, as patients, we all are. And I think that's something that's so important to remember, and, to really appreciate, day to day what you're learning and what you're able not only to give to your patients, but also to really acknowledge what you're able to receive from them, because I think we learn so much from the people that we work with, and to really appreciate those gifts as well.
Well, thank you, all three of you, so much for kind of sharing your insight and your experience. I think what I would say to my younger self is to just know your limitations. When you are in the field and you go into it because you do, have the desire to be helpful, to ease people's suffering, you feel very deeply. You also have to manage, knowing what your limitations are. And, the place that I've kind of arrived at now is telling myself, that Allah is in control. At the end of the day, I'm going to try to do the best that I can, but I can also pray for my clients. I can pray for, that, Allah serves them mercy and compassion. And so I see that well within what I can do as a professional to say, I'm going to keep this client in my dua. I don't maybe have to explain that to them. But when I sit and I reflect and think about, the blessings that, Allah has given me, and, also some of the challenges that I faced, I say, we're all here for a relatively short amount of time. And that at the end of the day, we are all striving, to be better, and to be able to understand ourselves better, so we know what that purpose and that meaning is for, the life that we've been given. So, to know that there are going to be times that, you know, I feel overwhelmed and stressed, and, you know, as Farida mentioned, having a personal therapist is wonderful, because how can we be professionals and then be reluctant to go to therapy ourselves, right? That's just kind of hypocritical. So, you know, being able to, you know, take advantage of that support and know that, you know, for me, it's kind of a preventative measure. You know, as Salma said, don't wait until the house is burned down, smoldering, to say, you know, maybe I need to go to a therapist myself to kind of process some of these issues. But, you know, I think in addition to that, to constantly seek out support, and, you know, highlighting different professionals. You know, I've reached out to some of you guys, and some others, you know, I've known. I'm just so impressed by the level, you know, the depth and breadth of experience in the Muslim mental health profession, that, you know, I want everybody to know, like, look, you can find a therapist that can meet your needs, you know, that may be experienced, or have specific expertise. It's really a growing field, so I'm really excited to be able to, you know, just really highlight other professionals and kind of the awesome work, the clinical work, and also the research that's being done, so that our community knows there are people out there, that, you know, have studied this, that have devoted a significant amount of time, in training to understand these issues, and, you know, are ready and willing to be of service. So just in the last 5 minutes, if you guys want to take like 60 seconds, what will be your last kind of takeaway messages that you would want people to know about boundaries, or about you, about your practice?
I think when it comes to boundaries, it's, Camila, you brought up a good thing. It's that idea of preventative medicine. So whether, we've talked a lot about boundaries in therapy, but just practicing boundaries in your life, whether it's how much food you eat, or saying, you know what, I don't have to be at this place till 10, but I'm going to get there at 9:45 just to practice. Or learn in parenting with some of the parents I see. Someone once told me that, like, if you can't lecture your kid and get your point across in 30 seconds, then you're doing a poor job. So even practicing, how do you say this in a way that you don't take 5 minutes and you can kind of see your kid's eyes glaze over and you're like, they're gone, they're not even listening anymore. So I think, if you really are reflective about it, there are so many opportunities to work on your boundaries, right? If you pray 5 times a day, like trying to pray right when the azan goes off on your phone, or if you really think about it, you probably have about 500 opportunities a day to work on a boundary, and it doesn't have to be some massive thing. And you'll see, without a doubt, I mean, we tell our patients this all the time, if you can kind of master this one area of your life, it's, in a positive way, it's contagious. It'll spread to other areas of your life. And it's the same thing for a therapist or any human being. If you can master kind of just that one moment, then you've proven to yourself that you can do it. Maybe you can do the next one and the next one, and then before you know it, you've mastered the day, and then you can get to the week, and that kind of thing. So I would say, you don't have to wait till you're a therapist. Start working on the things where something might be difficult or it might be easy, but just to be able to say, I'm going to purposefully try to do this. This is going to be my boundary, and see how it goes.
Right. I would want to add to that simply the idea that there is no one-size-fits-all approach when it comes to boundaries, and it's something that I think no matter where you are in your training or your professional career, it's something you want to continuously think about in terms of what feels right for you, and what feels right in this situation, and to constantly be asking and challenging yourself as to why you're making the decisions that you are, because that's how you really form boundaries that are meaningful for you.
I just wanted to say that the therapeutic relationship is an example of a healthy relationship, and establishing boundaries assists the client in understanding what a healthy relationship should look like. So I think that it's a benefit for the therapist and a benefit for the client to establish healthy boundaries, and it's appropriate for the therapist to set the example for the client.
And I want to make sure that if there are those who are listening, who are watching, who would like to get in touch with you, I'm just going to give your email addresses now, but we will also, send that out. I'm sure, there are other questions that may come up later, people who are viewing the Hangout, the discussion on YouTube. So to get in touch with Dr. Sadia Chowdhury, her address is email, email, at drsadia.com. That's drsadia.com. To get in touch with Sister Farida Salim Boyer, her email address is familycenteredots@gmail.com. Again, that's familycenteredots, as in Sam, at gmail.com. And to send a message to Dr. Salman Tour, his email is tf, as in Frank, c, as in cow, Knoxville, at gmail.com. And again, this will go out. It'll be posted. And, feel free to submit the questions. I'm sure that the three panelists, would be more than happy to share, to take questions. But also, I would encourage people to reach out and to continue the conversation, because this is, as in therapy, this is an ongoing conversation. You may be faced with different situations and not quite sure how to handle them. So I would definitely encourage seasoned therapists as well as inexperienced new clinicians to seek out that peer support and that supervision. And inshallah, our next conversation, our next hangout for the Healers Collective Forum will be in May, and May is Mental Health Awareness Month, and so it's our conversation is always the third Thursday of the month, 6:30 Pacific time, 9:30 Eastern. So in May, that'll be May 21st at 6:30, 9:30 Eastern, and we're going to be talking about how to develop better collaborations between mental health professionals and imams, and what are some strategies we can use so that we can have this ongoing dialogue between the profession but also religious leaders, because we know often there's sometimes tension between perhaps what our clients say, well, the imam told me this, and you're like, oh my gosh. So we want to talk about just how we have that conversation so that we can all better serve the community. So thank you for watching. Thank you three for being on. I know we're all Eastern time, so it's about 11 p.m. So thank you so much. Have a wonderful evening, and Juma Mubarak for those who are going to be at Juma tomorrow. So again, thank you so much, and I look forward to continuing the conversation. Assalamu alaikum.
Wa alaikum salam.
Alaikum salam.